Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saraceda is interpreting the meeting in Spanish. His interpretation will be available on the county's webpage and YouTube page shortly after we conclude this press conference. Santa Barbara County Parks reopened camping at Kachuma Lake Recreation Area and Halama Beach on Monday, June 1st. The county has increased cleaning procedures at the campgrounds to make sure everyone is safe. As of now, our camping parks are available by reservation only. Shifting transactions to the online reservation center and the call center has reduced the amount of interaction between staff and guests and allows the Parks Department to better manage the number of campers in the park and prevent unsafe overconcentration of visitors. Group camping sites remain closed to reduce the likelihood of large groups congregating. All county parks, including Kachuma and Halama, have remained open for day use throughout the pandemic with social distancing requirements in place. The Board of Supervisors will begin budget hearings next Tuesday at 9 a.m. The coming fiscal year is very difficult to predict because of the constantly changing economic impacts of the COVID-19 pandemic. The board will hear the latest revenue projections from county staff and the proposed budget priorities for each county department. Public participation and comment is encouraged. To arrange to speak to the Board of Supervisors about the budget, please call the clerk of the board at 805-568-2240. Governor Newsom recently announced an extension of his executive authority, or his executive order, to allow local governments to temporarily prohibit residential and commercial evictions. The governor's original executive order was set to expire May 31st, but has now been extended until July 28th. On April 6, 2020, the Judicial Council of California took Governor Newsom's first eviction order one step further and issued an emergency rule suspending eviction actions through the courts. The Judicial Council's rule applies until 90 days after Governor Newsom lifts the state of emergency or the Judicial Council amends the rule. The County of Santa Barbara also passed a local ordinance in anticipation the governor would extend authority to county governments to control eviction protections. Under the county's temporary ordinance, tenants have an obligation to notify their landlord in writing that they need to delay all or some rent because they cannot pay. The reasons for non-payment must be related to loss of income or substantial medical expenses stemming from the COVID-19 pandemic. To be fully protected, tenants must retain documentation that demonstrates their circumstances to their landlord. Landlords must remain patient and work with their tenants. Rent is not waived, only deferred. Landlords should encourage tenants to pay what they can so that when the time comes, tenants are able to pay. The goal is to develop a collaborative plan so tenants can stay housed while still meeting their financial obligations. The County of Santa Barbara is also developing a targeted financial assistance program to assist tenants in greatest need. High school graduations are happening this week. This is a special time for families and friends to celebrate the academic achievements of thousands of local students who've earned their high school diplomas. Many of these students are the first members of their families to achieve this academic honor. I want to take this opportunity to extend my personal congratulations to all local high school graduates. The world is in good hands with your future leadership. Families want to gather to their extended families together to celebrate this important milestone. Graduation ceremonies have been modified to protect the health and safety of students, family, and friends. This year, ceremonies will look different, but the importance of the occasion can't be diminished. Every member of the 2020 graduating class will remember this year for the rest of their lives. Please recognize it's also important to modify family graduation celebrations by taking care to practice good hygiene, physical distancing, and wearing face coverings. One local San Marcos High School student, Shakir Ahmad, who is not yet graduating because he's still a sophomore, demonstrated how young people could come together during this pandemic to call for change. Shakir created a spoken word video highlighting issues of systemic racism and calling for change. He recruited dozens of his fellow high school students to say, "I want justice," in the video. I want to commend Shakir and his friends for using their voices to call for change and promote equity in our schools. Visit KEYT's website to learn more about this youth-led project. Now we'll hear from Dr. Henning Anzorg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. We are reporting 23 new cases of COVID-19 today for a total of 1,737 cases. 32 patients are currently hospitalized, with 10 patients in the intensive care unit. 364 of the cases, or approximately 60% of community cases, have been from the Santa Maria and surrounding area in the North County. At the moment, we are seeing an increase in cases in that area. We are actively working with individual communities in and around the city of Santa Maria to identify sources of infection and spread of the virus. Our state-run testing sites continue to be available by appointment. The Lompoc site will be moving to Solvang as of tomorrow in order to give the residents in the Santa Ynez Valley an easier access to testing. The Santa Barbara and Santa Maria sites will remain open. Please, you can go online or call for an appointment. The webpage is lhi.care/COVID testing, or the phone number 1-833-688-5551. All are welcome to be tested, and it is free of charge. Our communities have now been more open for almost 2 weeks. Test results that will become available by the middle of the next week will at least partially represent the impact this opening will have had on new COVID cases. The current protests and rallies are likely to cause some additional viral spread, even though I've noticed that most protesters are behaving very responsibly with wearing masks and keeping at least some distance between each other. At this point, as a county, we are looking at our testing and hospitalization results in detail on a daily basis. We are eagerly awaiting these results from next week. Once we are assured that we do not experience an exponential growth in total cases or severe cases needing hospitalization, we will then determine which additional sectors in our industries can safely open their doors with modifications. Most industries are already in contact with advisors from the county or private sectors to get ready to open for business in a COVID-modified way. As soon as safely possible to do, we will then give the green light for the business to open. Again, I want to thank the community for the continued support of the public health efforts during these unusual times. Please continue to do so. Wear your masks, keep a safe distance, wash your hands, and stay well. Thank you.
Thank you, Dr. Anzorg. I also invited Isabella Gulo, Executive Director with Care for Paws, to join with us today. Care for Paws services prevent the suffering of animals and keep pets with their families. Care for Paws helps community members in need with pet food and critical care through their mobile veterinary clinic. Assistance to victims of domestic violence is another important part of their work by providing safe, anonymous refuge for family pets. Thank you, Ms. Gulo, for joining us today.
Thank you for having me. So, I wanted to share a little bit about information about the support that Care for Paws is offering to the community right now. We have worked since 2009 to reduce pet overpopulation, keep animals out of shelters, and improve quality of life for pets of pet owners in need. And we focus mainly on low-income, disabled, senior, and homeless pet owners. And the goal is to create a safety net where pets do not have to end up in a shelter due to lack of resources in a family or lack of access. So during the COVID-19 pandemic, we've been stepping up our efforts significantly because the need is so great countywide. So while the need for our services is always great, right now we see just a tremendous increase in the need for affordable mobile veterinary care, distribution of pet food, and also for our domestic violence program, which provides temporary foster care or boarding for pet owners, pets of pet owners who are experiencing domestic violence. So we're doing a lot of different things just on that we always did, but on a much larger scale right now. So for our mobile clinic, for example, we're right now on target to provide several hundred more free spay-neuter surgeries to the public. We're the only low-cost spay-neuter clinic open to the public during this pandemic. So the need is obviously greater, both from that standpoint and also because the other agencies are closed. And for our veterinary services, we're also increasing the number of animals, dogs and cats that we see. We provide a lot of vaccines, dentals, mass removals, and a lot of different care, health exams. A lot of people are struggling right now to take their pets to a vet, and we want to make sure we bridge that gap so that, again, no animal has to suffer or get taken to a shelter by their owners because the owners are worried that they can't provide the care that the pet needs. In terms of pet food distribution, we are distributing 4 tons of pet food weekly countywide right now. And we're distributing pet food in collaboration with the Food Bank of Santa Barbara County to seniors countywide. We're distributing food to low-income housing facilities, senior centers. We're distributing a lot of food through our mobile clinic. So every time we run the mobile clinic, we give out probably a ton of food. And we also have pet resource centers where pet owners in need can come and pick up food and also sign up for other services that they might need. We are providing foster care for homeless pet owners who might be going through a temporary transition. And we're stepping in with things like dog walking and cleaning of litter boxes and just basic care for pet owners who might go through hospitalization or might struggle in some way and need temporary help. And again, with our domestic violence program, we're collaborating closely with Domestic Violence Solutions as well as the DA's office, Victims Witness Assistance Program. So pet owners in need can contact us through them, or we can also be contacted directly by victims of domestic violence or through law enforcement. And the goal is to reunite the pets and the owners when the pet owner is ready to take the pet back. And in the meantime, we provide a safe haven, which is the name of the program, for the pets, providing lots of love and affection and exercise and anything that the pet might need, and then reuniting the pet with the owner in the end. So we're excited to be a part of the community efforts out there. We're getting a lot of support, which we're very grateful for. And we just really want to make sure that pets stay happy and healthy and with their owners for life. We have opportunities for volunteering, also, of course, for gratefully accept donations. And we, if anybody needs our assistance, they can go to our website, which is careforpaws.org. You can learn about our services there and also how to donate or sign up to volunteer.
Thank you, Ms. Gula, and thank you for all the work that you're doing with all the entire team from Care for Paws, protecting animals during the coronavirus pandemic. I'm so pleased that community volunteers and donors are helping you do your important work. Next we'll hear from Suzanne Grimacy from the county's Department of Behavioral Wellness.
Thank you. Good afternoon. I recently spoke to the importance of hearing stories as the only real way to understand perspectives. We are now finding ourselves not only as a community, but as a nation in a position of hearing the experiences of others. These stories are being shared loudly and with protest and deserve to be heard and honored as communities are working to break down the barriers of systemic racism. Not every story is a protest, but I do believe that all protests share powerful stories. It is during times of critical or traumatic events, times of crisis, that we have the opportunities to gain strength and comfort from others around us and from our community as a whole. A traumatic event brings people together, and despite how bad the event itself may be, it can allow for an experience that is positive and creates resiliency. If anyone was not already feeling this through our shared experience of living with COVID-19, we are no doubt sharing another experience together now, one that will be in the history books of our children's children. This is a time of patience, but it's also a time to be courageous and to be strong. In the many conversations that I've had over the last week, amid our shared experience of a pandemic and the call to end systemic racism, people are still having babies and sharing all the excitement that goes with new birth. People are falling in love and engagements are taking place. And important celebrations such as birthdays, end of the school year, and graduations are still taking place with modifications, but nonetheless, they are still taking place. I was able to pass by the San Marcos High School graduation last night and visually see the activity. It stirred many emotions for me. Some were sad to see the difference from what a graduation ceremony would normally look like. Pure joy to see the festivity and the excitement that goes with a graduation day. Gratitude that it could occur the way that it did, and knowing the extreme collaborative teamwork and hard work of the schools to plan the events the way that they have. And also a stark reminder that COVID-19 is still with us in our community. We have been at this a long time. We are adjusting as individuals and as a community. We are now shifting much of our focus to the nationwide unrest that we are seeing daily in our media. We know as a community, because we have been through this before, that we can come out of our current experiences stronger than before and with even greater resiliency. Take care of yourselves and take care of others. We have the control to shape our experiences. Some tips: limit media time, but check in once or twice a day to keep yourself informed. Take care of your basic needs. Eat, hydrate, get outdoors, move your body, feel the air. Keep a routine or schedule, even if it means creating a brand new one. Take breaks from your work or childcare activities and do something just for you. And stay connected. Get support when needed, and when not needed, be intentional about reaching out and connecting with another who may need that support. The Community Wellness Team remains available to help connect with resources and support, and will also be out in the community serving as reopening ambassadors, offering education and resource support for our local businesses with reopening. This team has been really exciting to watch and to hear of the many stories of the businesses who have been supported through the reopening process. As of this afternoon, there are 1,985 businesses who have completed their attestation process to open, and that is exciting. The Community Wellness Team can be reached by calling 805-364-2750. Thank you.
Thank you, Suzanne, and thank you for that important message about community wellness. Next, we'll answer questions on the phone.
Tom Bolton with Newshawk is up first.
Thank you very much. This is a question for Dr. Ansorg. I've seen that a couple of the hospitals at least have loosened up somewhat their policies on visitation. And I'm wondering if you can give us some kind of an idea of what people can expect in terms of skilled nursing facilities, assisted care facilities, and group homes. I've been asked numerous times, when will visitors be allowed again? Do you have any information about that?
I do. As a matter of fact, it's very important to us that visitors need to be allowed in these group homes and assisted living facilities. And actually, as of this Monday, there is more opening in that regard. The only facilities that cannot, unfortunately, have any visitors as of right now are the skilled nursing facilities. But hospitals, we have to limit it in order to prevent spread of virus. But assisted living facilities can have visitors in a modified way, and it's very clearly laid out in the last health officer order that you can find on our website. So we encourage the residents in these facilities to, embrace these new visitation guidelines and be cautious, and as they have always been. But I hope that this extra sort of allowance will help them stay in touch better with their loved ones.
I'm sorry, so is it, you said that is effective this coming Monday, or it was
No,
already
it
effective?
has been effective since Monday.
Okay, and so for example, what are some of the changes that are allowed?
Well, as you mentioned, in a hospital, we allow a designated visitor for the hospital stay per patient. Children who have to be hospitalized, both parents are allowed to visit, or guardians if they don't have parents. And for end-of-life care, there's always been exemptions in place that people can have visitors. We have to limit the visitation rights a little bit, but at least every patient, except for the ones who are in the hospital with COVID. Those patients may have a visitor now. Now in assisted livings, facilities and similar facilities, they can have a visitor. We encourage to meet in the outdoors because it's always safer, keep a safe distance. And the only ones that may not have visitors as of yet are the skilled nursing facilities for safety reasons.
Okay, and you said that's outlined in the most recent order?
Yes, yes it is.
Okay, thank you very much.
Yeah.
Thank you, Mr. Bolton.
And next up, we have Rayso with the San Ynez Valley Star.
Hi, thank you so much. This question is for Dr. Ansorg. We've seen some numbers go up in positivity, and I just wanted to clarify or find out if that is just because we've had increased testing and we've expanded the tiers, or if it's correlating with, quote unquote, reopening. So I just wanted to see if you could clarify that.
I think it is not yet due to the reopening because the incubation period has barely passed, and there's always a little bit of lag time. So we will see the result of the reopening by the beginning or the middle of next week and thereafter. What we're seeing, I think, is mainly a result of increased testing. Even though if you test healthy people, less than 1% test positive for this virus. And if you test sick people, a higher percentage obviously comes back positive. So we do have active disease going on, and but it is at a slight increase. And I think the additional increase in positive tests is due to more tests that are run overall. I hope that answers your question. I hope I didn't confuse you with my answer.
No, it's great. Thank you so much. I appreciate it.
Thank you, Raysa.
Thank you, Raysa. We have one question in writing to both Dr. Ansorg and Supervisor Hart. Thoughts about a peace rally at the Mission with live musician, believe tonight at 6:30. Any thoughts, precautions, recommend anyone participating in the protests and even peaceful protests, should they be tested for COVID?
I guess I'll start by saying we have an opportunity to demonstrate to the country how to do public demonstrations in a safe, COVID-19 environment by physical distancing and wearing masks and keeping as much space as possible around people throughout the process of being in public like that. The demonstrations that have occurred in our community over the past few days have been very peaceful and very thoughtful and considerate of those issues. And I think that folks have an opportunity to really demonstrate to everyone around our community and across the nation that we take this pandemic seriously and want to express ourselves strongly and forcefully on these important issues, but in a safe manner. And I think that will be what occurs tonight at the mission.
Thank you. There are no other questions.
I want to remind everyone how easy it is to get tested for COVID-19. Please help the Public Health Department and our community by taking advantage of the free COVID-19 testing that's available at any of the 3 locations in Santa Barbara County. The state of California is monitoring the number of tests we conduct locally, and the California Department of Public Health is holding us accountable to keep up a high local testing rate. I was recently tested, and fortunately my test came back negative. I don't and haven't ever had any symptoms, but I wanted to walk my talk. I called to schedule an appointment before 8 a.m. and was immediately got through to a very friendly operator who asked a quick series of screening questions. I requested a weekend testing appointment, and a testing slot was available in my neighborhood in just a few days. When I arrived at the testing site, there was no waiting, and the procedure was very skillfully done. It didn't hurt, although I'll admit I was a bit nervous. The entire process, including parking, took 5 minutes, and I was back in my car and on my way home before my appointment was actually scheduled. I received my negative test via email a few days later, and if you would like to get help, by getting tested, the location in Santa Barbara is at the Earl Warren Showgrounds. The Santa Maria location remains the Fairplex, and the Lompoc location will be moving to Solvang tomorrow at the Veterans Hall. Testing is done 12 hours a day from 7 a.m. to 7 p.m., 7 days a week. To make an appointment, go online to lhi.care/COVID testing or call 888-634-1123. As always, please continue to practice these 3 simple personal steps each day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. And number 3, if you feel sick, stay home and isolate yourself. If your symptoms worsen, call your doctor or clinic and follow their medical advice. Our next press conference will be Monday at 4:30 p.m. As always, if you have any questions, call the county's call center line number at 833-688-5551. Please be considerate, kind, and safe. Remember, we're all in this together, and we will get through this together. Thank you for joining us today.